Hi, it's Sam Crowe here, Director of Public Health for Dorset and BCP Councils, just giving you a very quick update on coronavirus. I'm really pleased to say that cases are now continuing to come down strongly in both council areas. We're seeing a 25% fall week on week under both areas, but it is really important that we continue to see that fall, and the numbers in the community still need to be much lower before we can start to contemplate opening up safely. But on the whole, it's really good news. Pressure in the healthcare system has definitely lessened. We are still seeing outbreaks affecting settings like care homes, and the past month has been really hard for those people working on the front line. And we do need to continue to stick to the public health measures as much as possible to avoid a return to increasing infection rates. So for now, that means continuing to stay at home unless essential, and keeping your distance, remembering to wash your hands and cover your face if you are in public. More positive news is a number of people in Dorset who have been vaccinated so far. Nearly 1 in 4 of people across Dorset and BCP councils have had their first dose, which is a huge effort to achieve that, and huge thanks to all the teams that have been involved in standing up that massive effort. We know there might be some people who are hesitant or unsure about whether to have the COVID vaccination, and I just wanted to make a few points to reassure people about the vaccine. All vaccines have to go through several stages designed to see whether they're safe and whether they will work in the way that we intend, i.e. to protect from the serious disease caused by COVID. In this country, all vaccines have to be approved by the MHRA, that's the Medicines and Healthcare Regulatory Authority. This is an independent body of experts that look at the data from all of the trials where they've been used and the safety data from those trials as well. So they're not just looking at the effectiveness of the vaccine, but they're also looking at all of the potential side effects that would have been picked up through those trials. Now, those trials have involved thousands of people, and we know that the COVID vaccines approved for use in this country have been effective at preventing people from developing more serious disease and reducing the number of deaths in people receiving the vaccine compared with people that didn't receive the vaccine. There can be some side effects from having a vaccine, but those are mainly mild and transient. They should be very short-lived. Overall, they are by far the most effective tool that we have to combat the disease, death and disability caused by COVID-19. So if you are offered the chance to have the vaccine, do take it up. I would urge everyone to take advantage of that opportunity. That's how we can get cases down.